Health officials expect to receive 50,000 doses from Pfizer. Now it's a race against time to make sure the vaccine is stored and administered properly. CBS 58's Christine Flores is live with how they're keeping the vaccine safe and effective. Christine.
Now that the Pfizer vaccine is in the hands of hospitals, they want to make sure the proper steps are being taken before, after, and of course during, while it's being administered.
If you remove that vaccine from the refrigerator and the amber colored bag and set it out, and you haven't added the diluent yet, it is viable for 2 hours. If you don't think you're going to use that vaccine within 2 hours, put that vaccine back in the refrigerator. If you don't do that, it will be non-viable and will be a wasted vial.
There's been lots of information released about the Pfizer vaccine. Now that it's in the hands of some hospitals, they want to make sure they're taking the proper steps before, during, and after it's administered. The Department of Health Services held a vaccine update about proper storage and application. The vaccine must be thawed out, given at room temperature, and not shaken. Hospitals are also given kits, which include needles, syringes, record cards, and PPE like masks and face shields. The state's Disaster Medical Advisory Board also met today to discuss the state's guidelines for those getting vaccinated during this phase.
This is such an incredibly dynamic and changing situation that anything we do now is going to be outdated within 2 to 4 weeks. So I think it's our nod to try to assure fairness, to work on the traditional inequities between urban, rural, and so on.
Now, once someone receives the vaccine, they can then download an app called vSafe. There, they can track their symptoms and have them sent over to the CDC directly. Reporting live from the Medical Center over in Wauwatosa, Christine Flores, CBS.